Hello everyone. Did you recently go to the dentist and they told you that you have a cavity that needs to be filled?
What? No!
Well, today I am going to walk you through how a white filling is done.
Houston, we have a problem.
This is Dr. Tamisha Denis and this is The Modern Smile. So, if you recently went to the dentist and they said you have a cavity,
Excuse me?
and you need a filling,
Well, nobody's perfect.
in this video, I'm gonna do a filling on someone who has a cavity.
Wait,
This is actually one of my most requested videos because this is probably one of the most common procedures that we do in dentistry.
I'm not gonna hurt you.
When the dentist tells you that you need a filling, usually there are two scenarios. Scenario number one is that the tooth has never had a filling before. We call that a virgin tooth, and that's the procedure I'm going to be walking you through today.
Wait, let me explain something to you.
Scenario number two is that you have recurrent decay. Recurrent decay just means that you've had a filling on that tooth before, and now we have to replace the old filling, whether it's a silver filling or whether it's a composite or white filling, take the whole thing out and do a new filling once more. So here you can see where he has cavities. He has cavities on the top of his tooth and also on the side of the tooth. And like I said, it's a virgin tooth, so that means that this tooth has never been filled before. And you can watch me start to drill on the top of the tooth. Now, when we're drilling the teeth, we have different kinds of burrs that we use depending on the scenario. And let me go back a bit. He is numb. I numbed him on the side and he does not feel any pain at all. He's actually a very good patient, very comfortable, and no pain at all. I always let all my patients know if they have any pain or discomfort while we're working, all they have to do is raise their left hand and I stop immediately and we give more anesthesia if necessary. So as you can see, and this video is on a little bit of a faster pace, I'm drilling out all of the brown areas of the tooth, and those are the areas of decay. I always caution my patients that cavities are not only what appears to be brown. Sometimes coffee and tea and other things that we eat can make our teeth appear brown, but that doesn't mean that all of it is cavity. Cavities are determined not only by x-rays, but also, cavities are not only determined by x-rays, but they're also determined by touch. So, and a clinical exam. So whenever I see a cavity in a patient's mouth, what we do is we look at the x-ray to see the depth of the cavity, and then we also touch the tooth because cavities are sticky and soft. Because remember, a cavity is an acid deteriorated area of the tooth that becomes soft and starts to cavite or create a hole in the tooth. So here you can see me drilling out all the brown portions of the tooth, and we're kind of going until all of it is gone. There are times when I am not sure if all of the cavity is gone, and I'll use something called Caries Detector, and what it does, it stains the area of the teeth that are still cavities, and so that I can know if for sure all of the cavity is gone. So here you can see me drilling on the side, and you can tell that there's a nice brown hole on the side of the tooth, and I'm using a different shaped burr to get all the brown areas of the tooth. Now, even though these cavities were quite deep, he was not feeling any pain before we did these fillings. And that is so important to note because people always think that if they have a cavity that it should hurt, and they don't always hurt until they get close to the nerve. Now this next part you can see, if you saw a green syringe that I was using, that's called limelight. Sometimes when we have some of the deeper cavities, I'll place that at the bottom in order to protect the nerve to make it less sensitive. After that, you can see we're putting this blue light on, and the blue light actually sets the material. So when I put the material in through that syringe, it's nice and soft, and it makes the material hard. The next thing that you're going to see me use is a bonding agent. And what a bonding agent is, it allows it's like a glue, and it allows the filling that I'm going to put in next to actually stick to the tooth. So the bonding agent is rubbed into the areas on all the different parts where I'm going to put the filling in, and then the light is there to cure the bonding agent. That's again a liquid thing that gets hardened by that light. And then I will start to put the filling in. Usually what I do before I put the filling in is I put something called a Flowable Composite, and that's still white filling, except it comes out of a syringe and it's nice and flowable, and that's why we call it Flowable Composite. The reason I like to do that is because this kind of Flowable Composite in particular is fluoride releasing, and that means it has cavity fighting component, just like the stuff you'll find in your toothpaste. So we put that at the base of the cavity, or at the base of the preparation, I should say, of the tooth, to protect from future decay. Remember how I talked about before that even though you had a filling before, you can need a filling again, so it helps to protect against that. The next thing you're going to see me use is something called Sonic Fill. In my office I use, it's actually attached to a handpiece, and the white filling comes out of that handpiece and it vibrates into the bottom of the tooth to kind of fill all the nooks and crannies and crevices. And now you're going to see me using an instrument in order to kind of mold that material into the tooth to form the shape of the tooth. And it's going on the top of the tooth, it's going on the side of the tooth, and all that. You can also see a cotton roll in the side of next to his tongue, because this is the area or the time during the filling where we like to keep everything nice and dry. So that's what you're seeing right there, is cotton roll sitting down there, and ever so often you'll see the assistant suction to keep the saliva away. And now I'm molding that material, and after I mold the material, then I'm going to put a light onto the tooth again to cure the material and make it hard. Next, we will do something called checking the bite. So what we do is we have the patient bite down on a piece of paper that has little marks, and then those marks will appear on the tooth, and wherever the marks are not supposed to be, I will smooth them or shave them down. Now most people, I can get them very, very close. There are times where the anesthesia wears off and you're not numb anymore, and you go home and your bite doesn't feel right. And if your bite doesn't feel right, then you'll return, and I don't have to numb you or anything. I will just smooth those areas out to restore your natural bite. So that's the end of this video. Thank you for watching this video. I hope you learned something about white fillings or cavities in general, and hopefully this makes you a little less anxious for your next dental appointment. If you like this video, make sure to subscribe and to give me a thumbs up, and also comment in the notes below. Thank you for watching.